It's obvious that nothing is happening. You know, this is our fourth rally and we have had no commitment from our government to do anything for our staffing whatsoever. There is evidence in Victoria and Queensland that safe staffing really, really works. Why can't we do it here?
Underpaid, overworked, not safe. We are heroes, but we are treated as a zeros.
Every day I walk out of the emergency department and I know that I haven't been able to do my best and give the best to my patients, and I, am almost in tears at the end of every shift because I know that I just can't provide the best to our patients, and our community deserves better.
When it's understaffed like everywhere else, you just question why you're doing nursing and wish it would get better.
We just want safe nurse-patient ratios to provide safe care to our patients.
We don't have enough midwives to look after the amount of babies and mothers that we have that need higher care these days. Some midwives per shift can look up to 10 mums and 10 babies, which is way too many to give safe care.
We're often working down, and because the accepted culture is that you adapt and that we don't fill shifts because that's not something we've ever done. We're often working in unsafe conditions, but the fact that we don't have ratios leaves us vulnerable, and that's the bottom line.
It's not safe at all. We're literally putting people's lives at risk, and it's on us at the end of the day. We're the ones that have to show why we're doing what we're doing, and without our backup from the government, it's our registration that's on the line every single time, and we're just sick to death of it.
More and more staff are leaving and the situation's getting worse every day, so we need to do something.
We've got so much overtime going and we're just getting burnt out,
State government wants to run the hospital system on as little money as they possibly can by exhausting and burning out nurses and midwives.
The government doesn't appreciate nurses do a wonderful job. They think we're just going to keep going, not worry about us. We don't put up a scandal or a fight. We just do our job because we love it. Not anymore.
If you look at history and you look at wins for better conditions, it takes a solid campaign and a solid commitment, and we need to keep going, and we will win.
We keep letting the public know, we keep letting the government, putting pressure on them. I think the more strikes we do, the more people are seeing us. We need to keep that momentum going.
Our healthcare system is absolutely appalling, and we will keep striking until we get what we deserve and what our patients deserve for the better of our community.